Welcome to Idea Collider, a regular podcast hosted by me, Mike Rea, where I speak with the people who I regard as the most interesting within the pharmaceutical space, or I talk with the authors of the books that I've found most interesting on the subject of innovation. So enjoy. Welcome to one of my favorite authors to this book club. I'm delighted to welcome Brian Christian, who I've been a fan of since reading The Most Human Human, and then followed through Algorithms to Live By, which was just another kind of fantastic guide to thinking about this stuff. And I was so pleased to see Brian touch on the subject, which I'm going to say I'm curious about, but know almost nothing about, which is AI and machine learning, because we see so many figures in our space about what's interesting and what's coming and what's not. So Brian, welcome to Idea Collider. Could you
Thank you very much.
tell us a little bit about yourself and your journey to today?
Sure. I have a very unusual academic background. I studied computer science and philosophy before going to graduate school for writing. And really, my career as a writer has been about this question of what computing teaches us about what it means to be human. And that question seems kind of inexhaustible, especially in the moment that we're living through with AI. Um, and so that's something I've explored through this question of communication and the Turing test in my first book, through the question of rationality and decision making in Algorithms to Live By, and in this book, the alignment problem, looking at these questions of human values, human norms. How might we actually expect to instill that into these machine learning systems that are increasingly prevalent throughout um, society, both in these kind of high profile ways, self-driving cars, et cetera, but also in these consequential but less sexy ways, in which machine learning is kind of percolating through the criminal justice system or medicine, et cetera. Um, so that's been the focus of my research and my writing for the last 5 years. So I've been working on this book. I'm also a visiting scholar at UC Berkeley, where I'm part of the research community there. And so that has been really my focus: is how how are we trying to deal with this problem that's called the alignment problem, which is these machine learning systems that learn by example, learn from data. Are they really learning what we think they're learning? Are they really going to behave the way that we hope they're going to behave or intend for them to behave? Um, how much do we have to really be worried about that, and what are we doing about it?
Yeah, and so keen to dive into that sort of question of what how you define that alignment problem, and the thing that struck me a little bit like the other books was this thing about learning about our humanity at the same time as we're learning about computers. So could you maybe start just with a simple kind of explanation of what you mean by the alignment problem?
Sure. So the term alignment problem, the term goes back to 2014 from UC Berkeley computer scientist Stuart Russell. But the idea really goes back at least as far as 1960 from the MIT cyberneticist Norbert Wiener, who has this famous essay where he says, if we use to achieve our purposes a mechanical agency with whose operation we cannot interfere once we have started it, then we had better be quite sure that the purpose we put into the machine is that which we truly desire. Um, and that has become a kind of scary thought experiment for many decades within AI. By the beginning of the 2010s, people were talking about the so-called paperclip maximizer. Could you build an AI and with best intentions, you tell it you want to maximize the paperclip productivity of your paperclip factory, but it ends up colonizing the universe and turning everything into paperclips, including us. Um, these sorts of thought experiments where it has kind of a sorcerer's apprentice flavor. Um, you tell the system what you want, and it interprets your wishes all too literally. That I think became much more the focus of the concerns that people in the AI community had. Not this kind of Terminator thing of it becomes sentient or malevolent or it turns against us, but this kind of monkey's paw, sorcerer's apprentice thing of it's trying to do what we want, but we've failed to articulate exactly what we want, and we get something that's kind of this horrible, perverse instantiation of exactly what we've asked for. So that is very quickly, I would say, moving from the realm of thought experiments into the real world. We're seeing systems that, facial recognition systems that only really work on white males because of the data set that was used to train it, things like this, where there's some kind of slippage between the examples that you use to train the system and the environment in which you actually deployed that system. And so this ranges from, as I say, just kind of like sharply differing accuracy rates in facial recognition based on skin type and gender, all the way to self-driving cars that kill people because they, famously the Uber self-driving car that killed a pedestrian in 2018, the training data didn't include jaywalkers. And so it was just not prepared to encounter someone outside of a crosswalk. So there are many examples like this, but it's basically this question of, will the system really behave the way that we want it to, given the way that we've trained it?
Yeah, and there's some really interesting examples in the book for those of us who are not as familiar with this of, sometimes perpetuating, human frailty in stereotyping or pattern recognition or whatever. Could you give us some of those examples of, the very famous, inability to recognize, skin types or other characteristics?
Yeah, I mean, there's a number of examples that come to mind, and they range in terms of exactly what the nature of the problem was. But one of the things we're seeing, for example, in large language models, we're building these models that exist to kind of predict the missing word in a paragraph or in a sentence. And it turns out that with this generation of models called word embeddings, you get this mathematical representation of the word as kind of a point in 300-dimensional space. And you can actually perform arithmetic operations on these points. So you can say king minus man plus woman, and you get something that's near to the word queen. But you also get these really sexist stereotypes. So there was one which was doctor minus man plus woman equals nurse, or computer programmer minus man plus woman is secretary or homemaker. And so in that domain, in a funny way, that's almost the reverse problem of what you see with image recognition, where in the image recognition, there's kind of this copious or this, noteworthy absence of something from the training data. In these language models, it's almost the opposite. It's almost like they've taken in the culture too well. They've absorbed not only the things that we wanted it to absorb, but all of these sort of prejudices and stereotypes. And then you have to figure out how to get that out of your model depending on what you want to actually use it for. So there are many examples, but that's just one.
Yeah, and you touch on this in the book as well, this idea of understanding what it is that the system is actually seeing versus, that you think it's seeing, like the idea of, training it to recognize blur in landscape photographs instead of the...
That's right. Yeah, so this turns out to be really critical. There's kind of this path of least resistance when you think about training these models, that if you're training them to recognize, let's say, sheep, the model doesn't have any kind of preconception about what a sheep is. And so it's whatever distinguishes that set of photos from another set of photos, it will be like, that's a quote unquote sheep. But the labels are meaningless. And so there's this question of, has it really internalized the category as we understand it? So for example, the sheep detector may just be looking for the color green, right? Because that would be a much easier way of determining if a photograph is like in the sheep category. And there have been a number of real world examples like this, where there's a researcher in Oregon named Will Landecker, who was training a system to identify the presence or absence of an animal in a photograph. Well, so he thought. And so he had a bunch of photographs with animals in a landscape, and then another set of photographs that were just empty landscapes. And he thought that the system would learn to identify, you know, facial features and whiskers and fur and all these things. Um, the accuracy was really good when he actually trained it, but then he went in with a set of techniques known as saliency maps that show you essentially what parts of the image are key to the model's final decision. And it turns out that the models was fixating on the background of the photograph, which completely confused him, until he looked a bit deeper into it, and he realized that if you have a photograph of an animal in a landscape, the animal is usually in the foreground and they're in focus, and so the horizon is very blurry. In photography, this is known as bokeh. In an empty landscape, usually you have a really long focal length, and so the horizon is crisp. And so it turns out that it's a lot easier for this model to identify a blurry background or versus a sharp background than it is to identify noses and fur and all of these other things. So he thought he built an animal detector, but he really built a bokeh detector, a blur detector, essentially.
Yeah. And that has relevance in our world. I think you might give the great example of the ruler being more important in dermatology
Exactly right.
than the malignancy itself.
Yeah, exactly right. So yeah, these models are, you know, if you want to think about it this way, sort of lazy. They will take the path of least resistance. And so yeah, as you pointed out, this has come up in dermatology settings where you're showing, you know, some kind of discoloration, and you're saying, is this a malignancy or not? And if you're not careful about the way that you do it, you will find, using these kind of saliency techniques, that what your model is really looking for is the presence or absence of a ruler next to the malignancy, because a lot of medical images of you know, malignant lesions and so forth have a ruler for scale. So the correlation is real, but of course it's not causal, because if you don't know what it is, you're not going to just have a ruler there until after you've already made the diagnosis. But the model doesn't know that.
Yeah. It's I loved those examples, the kind of understanding of why some of your concerns might well be valid when it comes to, you know, what this stuff is doing. But in the book, you kind of you look into maybe the kind of there's three sections, right? The kind of first section dealing with you know, why we should be concerned, if that would be a reasonable characterization. You know, what we want the systems to do for us, and then some kind of you know, how we could think about doing this better. Could you maybe lay out the kind of flow of the book, what the, you know, for a casual reader, what they would expect to encounter?
Yeah. So as you say, the book is kind of has this tripartite structure. The first third is, it's called prophecy, which is maybe a highbrow way of saying prediction. And that looks at these kinds of real world um, present day cases of machine learning systems going wrong, usually by making these sorts of, you know, aberrant predictions. And that gets into these questions of bias, of fairness, of transparency. Um, how can we think about the data that's going into the model, what the model's explicit objective is, and then sort of what's going on inside the black box, so to speak. The middle third of the book, which is called agency, shifts the focus from systems that make predictions to systems that take actions. And it looks at kind of at this point, you know, 130-year history of mechanical systems that actually take actions within an environment, and how that's rooted in animal psychology going back to the 1890s, by way of B.F. Skinner, and asks this question of what are we discovering about kind of fundamental um, laws of learning and behavior? There are some incredible connections between the machine learning of what's called reinforcement learning, which is how to take actions to maximize um, rewards and minimize punishments in some environment, however metaphorical that environment is. Um, there are some incredible connections between that and the dopamine system, which suggests that, to my perspective, suggests that we're really sort of onto something with this vein of research. We're not just developing clever engineering tricks that solve certain problems, but we're actually kind of discovering from first principles some of the actual mechanisms of learning, the same mechanisms evolution has discovered. Um, and
And
yeah,
those same systems being, we're learning about how we learn at the same time as we're learning about how computers learn, right?
that's exactly right.
Yeah.
Yeah. And so that gets into the links between machine learning and developmental psychology. So what are we learning about the brains of infants, and how is that informing AI research? So that middle section kind of lays this cognitive science foundation of um, the dialogue between AI and developmental psychology, and the questions it raises about like human motivation, human incentives. There are a lot of unexpected, I think, connections to parenthood in terms of designing rules and incentives and rewards that don't have horrible loopholes that can be exploited. This is something I think parents
Yeah.
will be familiar with.
Yeah. And I love those kind of examples of the loophole spotting, right? It sounds like lawyers on steroids was that one about the bike or the cycle that you try and train the cycle to go towards a goal, and it spends most of its time looping because it gets rewarded for going towards the goal, doesn't get
Exactly right. Yeah.
disincentivized for going away from it.
Yeah, AI systems. Yeah, lawyers on steroids, I think, is a good analogy. Every researcher in reinforcement learning has their own kind of cache of horror stories about how their system, exploited some loophole that they didn't intend. And so, yeah, one of these is the bicycle, which you want to make the system ride a bicycle to a goal, so you give it points every time it's making forward progress. But it learns that it's much easier to just ride in a circle when it's technically making forward progress half the time. It's easier to just go in a circle really quickly than it is to actually learn how to ride the bike. Another example like this, there was a group at Stanford working in a robotic soccer competition, and they decided to give their robots this little incentive for taking possession of the ball. But it turns out that it was easier to just go up to the ball and vibrate their paddle and repeatedly take possession of it than it was to actually coordinate and attack and score points. So I think this is a very key issue in this question of how we're going to um, get these flexible, general AI systems to do what we want. Is this critical incentive design problem, which has, that's a human problem that goes back as far as human civilization. Something economists think about, and this is where the term alignment is borrowed. It's essentially borrowed from the economics literature. People in starting somewhere around the 80s began to use this word alignment to talk about, like, can we align the values within an organization? Can we align the incentives of two parties in a contract, or a manager and their subordinates? So it's a reminder that, for better or worse, this is one of the oldest and most intractable human problems, is how do you design appropriate incentives to get the behavior that you want? But
Yeah.
increasingly, this is kind of what's keeping AI researchers up at night.
Which is interesting because those almost small scale challenges, I'd be interested in your prediction about whether they could ever get to organizational level challenges, because we've got this you look at the pharmaceutical industry, and we've always talked about the perverse incentives of building pipelines, moving things through the pipeline, getting them to humans, getting them to be any good when they get there. But the belief is that the problems of drug discovery could be solved by AI. And I go, well, if your incentive is just to increase number of candidates, it may not be worried about whether these candidates are viable or any good or they have any value later in the system, because our current systems don't reward that behavior today. So there's nothing to train, nothing to train an AI on when it comes to spotting good drugs versus bad ones. But I'd be interested in the kind of Stanford football question up to the organizational level.
Yeah, I mean, my feeling is that, um, at the broadest level, I think that the challenges that we face as a global society right now are essentially alignment problems. Um, that we've organized society through explicit, key performance indicators, you know, uh, objective benchmarks and targets, whether that's GDP per capita or quarterly revenue or whatever it is. Um, but there are these weird externalities that don't get priced in, which include the climate or they include inequality or whatever it might be. I think so. I think those macro challenges that we're confronting right now are exactly of the same form as the kinds of problems that uh, lie ahead for us in AI. It's just that those systems are built of people. And so one just intuitively expects that it will only get worse if you have these systems essentially on autopilot. Because at some level, I mean, if you're, to use your example, if you're working in drug discovery and you're incentivized somehow to maximize the number of candidates, but you don't really care because it's not in your, incentive whether the candidates are viable later on or something like that. I think human beings, at the very least, would have some sense of like, purpose. I want to feel that the work that I do is meaningful. Therefore, I don't want to just myopically hit some target and knowing that these are bad drugs. I want to like feel proud of the work that I do. I want to be able to tell my kids, yeah, I helped invent the such and such drug. That was my work. You want to hold your head up high with your colleagues. You don't want the people kind of downstream from you saying, oh, so and so's drugs are, a hot mess. They're just these random molecules. So there are all these kind of intangible but very consequential kind of extra incentives that we have interpersonally and just kind of in terms of our own motivation psychologically. So if you take all of those out of the picture, then you really are um, hoping that you've made everything that you care about baked into this whatever objective function you're giving, because the system isn't going to care about all of those other things that people
Yeah.
care about.
And a lot of the book is about that almost clarification of purpose, right? The specification of purpose, the kind of design of purpose for an instruction. I think, to go back to that kind of sorcerer's apprentice sort of an analogy, being very careful what you ask for and being very careful what you don't. And examples from lore and gun violence and other things in the States are hugely instructive.
Yeah, yeah, and kind of closing the loop on your structure question. So the final third of the book kind of picks up here, and essentially, a lot of the current thinking in AI is that it's essentially too dangerous to explicitly design these rewards because of this set of problems. And so it may be that we just can't build systems that way. And yet the mathematical foundations of the field are all about maximizing these explicit objectives. So how do you kind of square that? And the final third of the book really gets into um, the state of AI alignment research today, which is about systems that can, rather than being given an explicit metric, they can essentially infer their own metric by demonstrations or by examples. So, one way to solve this, let's take the example of self-driving cars. Instead of saying, I'm going to program in, a numerical value for how bad it is to knock over a trash can versus hit the curb versus get a flat tire, whatever. Which just seems hopeless and impossibly brittle, whatever you came up with. Instead, we'll just do something very simple, which is to say, have the car attempt to drive the way we drive. So it will just observe us on the road and map inputs to outputs such that it does the same stuff that we do without ever forming an explicit representation of, the pros and cons of doing certain things. And this is something we see in Tesla cars today. They have what's called shadow mode, which is basically if you've got a Tesla, even when the autopilot is turned off, it is still in fact running in the background. It's just not controlling the car, and it's constantly asking itself 10, 20 times a second these hypothetical questions of, if I were in control of the car right now, what would I do? And it's comparing that to the way that you do drive the car in real time and generating this error signal that gets beamed back up to Tesla headquarters and used to kind of train future versions of autopilot.
Which I found such a fascinating example of, I'm going to call it asymmetric learning, because we've been using that term here, that your organization's ability to learn is going to be based on your ability to train your kind of engine, and the idea that Tesla drivers are training Tesla's learning system is fascinating, and I think you use that example with the sort of DeepMind thing about the way that the system learns is at least as important as the amount of training data that it has. Was it the stat that 130 years worth of coding how to play a game was beaten within a few days by a different system of learning?
That's right. Yeah. So this is the evolution of their AlphaGo series. There's now kind of 4 or 5 different iterations of that, and one of the big breakthroughs that they made in the realm of board games, Go, chess, shogi, was essentially weaning itself off of human imitation. So this is kind of interesting because there's a little bit of a dynamic tension between this and the Tesla example, where the first version of AlphaGo, which defeated an international champion, was trained based on a giant database of human expert games. And this is the methodology that's gone all the way back to Deep Blue and before, is you start by imitation, right? The same way of, and I think this is to some degree how humans learn, right? You learn to kind of be like your idols, or imitate your parents, etc. But it only gets you so far, as it turns out. That at least in the realm of Go, beyond a certain point, building the system to imitate human expert play actually became a liability. And they were able to make a new generation of the program called AlphaGo Zero. Zero meaning how much kind of human data it was given in advance, zero, which began from kind of random initialization of parameters and just played against itself, and were able to, within a matter of days or weeks, surpass the previous version of the program that was built on human examples. So that's a powerful example of what you can do in one of these closed domains where, I don't necessarily imagine that cars will follow the same path because the world is just too unpredictable. But at least in these kind of little petri dishes, the world of board games, where you have kind of, the rules in advance, you have a perfect simulator that you can use to try things out. It turns out that, in some of these cases, human behavior is actually more of a liability than an asset. So that's the irony there.
Yeah, and that example that you give in the book of, who you imitate is going to be hugely important as well. And I think this is one of the things we face within sort of medicine is, are you improving the worst doctor out there, or are you emulating the best doctor out there? And what is it about them? Because who you are when you're emulating is important, because if you take the skills of the best doctor and try and give them to the to a junior doctor, they may be the wrong people to give those skills to. And I love the way that you elaborated that kind of idea in the book.
Yeah, I mean, this is something, Tesla has this problem, which is that there are bad drivers in the world. And so you don't necessarily want your autopilot to be emulating their bad driving. And you have a little bit of a chicken and egg problem, which is how do you identify the bad drivers unless you already have a formal model of what good driving looks like? But that's the whole point, is to develop such a model. So how do you break that catch-22? I think there's some interesting technical questions there.
Yeah, and as you say, most of the time, good drivers are doing things that are pretty boring, right? It's only when something bad happens that that you find out whether they're good or not.
Yeah, and that itself is another aspect of the challenge, which is that most, if you were to record real-time video from every single camera and stream that all back to Tesla, times every hour of the day the car's driving, times every car on the road, it's just too much. It's overwhelming. So you need to identify the interesting bits, where are the rare events, or where, and so often what Tesla will do is they'll have some kind of trigger. Let's say they want to make they want to be better at predicting when the car is going to get cut off. They have to have some trigger that identifies in your car when you've been cut off, and then says, that was an example of what Tesla is looking for, so I'm going to send them that event. But as with many things in machine learning, there's kind of this unknown of uh, you're filtering the car's experience by looking for something that you've already kind of explicitly defined in advance. And so how do you know about all the stuff that's happening that you're not even looking for, or it's not, in that filter that you're using? So that's another question.
Yeah, and that idea of whether it could explain why it did what it did as well is also fascinating. Certainly, as you get into the kind of medical realm, I think you've got a great quote in there about if a computer, your next visit to the physician tells you that with 99.9% certainty that it is confident that it knows what the treatment should be, but can't explain why. How much would any of us trust that system?
Yeah, this is, I think, very critical, and this is, obviously relevant in a medical domain. And there's, I think, really two things intersecting here. One is that the probabilities that these systems output are often not particularly well calibrated, or not particularly useful to us in terms of what we think confidence means, or certainty. So, for example, many object recognition systems are trained using a data set of examples that fall into, let's say, one of 1,000 categories. It's either a cherry or a Dalmatian or a fire truck or whatever it might be. And there's this peculiar thing, which is that the system implicitly comes to learn that every image is exactly one of those categories. So if something has a Dalmatian next to a bowl of cherries, it must be either a Dalmatian or a cherry. There's no yes and. It also comes to learn implicitly that everything is one of those 1,000 categories. So if you show it a bunch of random, pixels, it still has to make its best guess as to what category that nonsense belongs to, because everything it's ever seen was one of those 1,000 things. And so for a program to say, okay, I think this garbled static is, I'm 99% sure it's a gibbon, as opposed to a Dalmatian or a bowl of cherries. But what is that? That's not useful, because that's not really the question that we're asking. And so there's been a lot of work by people like Tom Dietrich in Oregon, Yaron Gall at Oxford. There's a whole group of scientists now working on this question of how do we get uncertainty estimates that actually mean something. How do we design systems that are aware that many of the things they see will not fall into any category, or may kind of be between categories and things like that. You saw this with the Uber self-driving car. Again, the pedestrian that was killed in Arizona. She was walking her bicycle across the street, and the object recognition system had a category for pedestrian and had a category for bicyclist. But it didn't know what to do with someone walking a bicycle, because it seemed to be, okay, her feet are on the ground, but I'm seeing the frame, I'm seeing the tires, and it was switching back and forth between these categories like 10 times a second. um, that's a sign that your program's kind of ontology is broken. So there's a lot of work there around this question of how do we get meaningful uncertainty estimates. If you're switching back and forth between categories, that alone is reason to slow down. It doesn't matter what your ultimate decision ends up being. The mere fact that you're changing your mind should already be a reason to apply the brake in that case.
Mm.
Um, and then there's the second question that I think intersects with the uncertainty question, which is the kind of interpretability. What's going on the inside of the model? Can we sort of pop the hood and make sure that the internal representations match our intuition? And
Yeah.
yeah, this is something we could get into as well. Yeah.
Yeah, because there was that sort of node in the book, for me at least, where clear to most of the folks in this area, but the idea that a lot of these models now are not coded. They are self creating. So actually whether they could ever explain it to a human, how they arrived at a decision is genuinely fascinating going forwards. But the idea that there wasn't a sort of a dumb or evil programmer sitting at the beginning that coded everything into that, whether it was a pedestrian or a bicycle, but that they're learning themselves and teaching themselves how to learn was such a fascinating kind of bifurcation for me in this space.
Yeah, and there are limits to what can and can't be explained. So one example for me in the realm of Go, there was in the famous match between AlphaGo and Lee Sedol. Lee Sedol only won a single game, and so this is kind of celebrated by people who are rooting for Team Human. There was this one particular move, this very dramatic kind of wedge move where he played a stone kind of into the crack between these two formations, and it ended up being this very decisive moment in the game. And so the thing we always want is like an explanation of what did he see that the computer didn't see. And for me, there's this kind of lovely moment that happens in the press conference after that game where they ask the DeepMind team, how did AlphaGo miss that move? And it's interesting because AlphaGo, part of its decision-making process is this very explicit, what's called a tree search, where it says, okay, if I go here, then they go there, and I go there, then what happens? And it's doing this, hundreds of thousands of times. And so you can, record that and have an actual transcript, essentially, of everything it considered. But the problem with Go is that there are too many moves at each step. So it has to be very selective about which moves it considers. And for that, it uses this neural network that just kind of assigns a probability to the likelihood of each move in a sort of gut instinct way. And it turns out that this particular wedge move was just assigned a very low probability of being played. And so the system never considered it at all. So that's kind of an unsatisfying explanation because we wanted to know, well, what paths in the move tree were you exploring such that you thought this wasn't a threat? And it just said, I was so convinced a priori that it wasn't a threat that I never looked into it at all. And so, yeah, there's something interesting about kind of the limits of what can and can't be explained. And then, of course, they asked the human player, Lee Sedol, why did you play that move? And he said, I looked at the board and it was the only move that suggested itself to me. So I didn't even feel like a decision. Wow. So it's just this equally mystifying, kind of unsatisfying process.
Yeah, and I guess that is equally true, not just of machines, but of humans as well. And I love that explanation of the getting out of the book, or is it getting off book, as you talked about in chess, was the idea that there's a kind of most of chess is boring, right? When you're playing against someone of the same standard, because you know exactly what each is doing until something unusual happens. But I kind of like that idea within our space as well, of like both predicting inputs, but also the outputs, because, you know, as you said, the outputs might be 10 years away. The idea that you could properly map all of the what ifs that might happen between now and then is kind of fascinating as a challenge for you know, drug design or for medicine.
Yeah, I will say, you know, there's been a lot of really exciting progress in this interpretability space of like how to figure out what's going on inside a model. So I'll highlight a couple things here. One, there are people like Cynthia Rudin, who's at Duke University, um, pushing this line of work that says rather than using our computational horsepower to train a huge black box neural network, let's use that computational horsepower to search the space of all possible simple models and find a simple model that uses only, you know, 2 or 3 variables or 6 variables, excuse me, with, you know, integer coefficients, or it's, you know, you can write it on a piece of paper and that's still competitive with these neural networks. If there is such a simple model that meets those criteria, we can find it. We can find that needle in the haystack. And so I think that's really useful for medical diagnostics. It's possible to have a model that is competitive with a neural network, but you can still put it on a physician's notepad, you know, put it on a clipboard. And then you also have the full confidence of, you know, as you're filling it out, you know, you're just adding up some integers by hand, doing, getting a, you know, a 6 plus a 1 or whatever. It's very clear how the diagnostic criteria are being met. And so um, you have this added benefit of kind of trust, confidence, et cetera. So that work I think is really, really cool. And of course, that's only possible if your inputs are themselves kind of human legible. So if your inputs are like blood pressure, age, sex, whatever, then you can maybe build this very parsimonious, transparent model out of those things. But if your inputs are just like an X-ray scan, then you're not starting with human legible inputs. So you're probably going to have to use some kind of neural network to make sense of that raw sensory data. But even there, um, we're increasingly seeing, I think, some really exciting work around how can you constrain that model architecture to make representations that are sensible to people, or how can you kind of go in and inspect what's going on inside that network after the fact. So that for me is one of the more surprising and encouraging areas of this research. Of it
Yeah.
wasn't necessarily going to be the case that we could scrutinize the inside of a neural network. It turns out that it's more possible to do that than we might have expected 5 years ago. So that's very cool.
Interesting. And I guess in terms of the sort of sweep, the broad sweep of the book, you know, one thing is that it has, you know, those of us with sort of gray hair and a glint in our eyes, you know, thinking about all the things that we've learned in the last 20, 30 years, suddenly being confronted with a new set of possibilities. So I'm kind of interested in that idea of how, you know, judges or lawyers or physicians or CEOs of pharmaceutical companies get their heads around, you know, both possibility but also desirability of, you know, machine learning and systems like this. You know, within that scope of the book, is it about introducing us to possibility, or is it about the kind of warning of the you know, taking it at face value?
I mean, I think it's both. I think it's certainly both, and I think we're going through a very exciting but kind of harrowing moment, as you know, civilizationally, where a lot of this technology is getting rolled out. And you know, imagine you're a judge. You've been sitting on the bench for 25 years. You never learned about machine learning, and now all of a sudden, a law gets passed that says your pretrial detention decisions have to be informed by an algorithmic risk score sheet. And now every defendant that gets brought before you, you have some score sheet with numbers on it and graphs, and um, you're expected to have sort of a level of literacy, not only to interpret what these scores mean, but to understand when a defendant might be kind of out of the normal distribution of the model, and maybe the score is less reliable for this particular person. Um, that's asking a lot, and you know, part of what I was trying to do with this book is to offer a little bit of an on-ramp for people who are now suddenly finding themselves having to, fill in some of that fluency, and wanting a crash course in both the actual kind of vocabulary, the jargon of the field, but more importantly, an intuition for when it can be trusted and when it can't. Um, I think that having a little bit of an intuition for, asking these questions about what was the training data set? Does that really match the environment we're going to deploy it into? What exactly was the objective function that we were trying to minimize when we built this?
Mm,
How might that or might that not generalize to a new situation? Trying to give people a better intuition, because I think to your point, it's not just the actual engineers and scientists building these things that need to be thinking of that, but it's the actual kind of executives, decision makers that are kind of overseeing these things in terms of having better instincts about when when we can trust it, when we can uh, kind of let it loose versus when we need to really think carefully. Yeah.
And certainly the idea of making data that is useful to the system that you might want to put it into. I mean, we've got this long history in the pharma space of, databases that don't match, that using different collection systems in early stage versus late stage, even for the same drug. Comparability, even measuring things as basic as the size of a tumor, right? We're still almost in the dark ages with some of that stuff. So, sort of generally fascinating. But I'm aware that I'm eating up time. So Brian, if people want to find out more about the book, certainly they can go to the book. But what's the sort of fastest route to get to you and your work?
I'm on Twitter at Brian Christian. And I also have a website, which is brianchristian.org. So either
Nice.
of those should do it.
Nice. And a question maybe that I had forgotten to give you in advance, but you recommended reading or any books that you've found, particularly interesting at the moment?
Um, Gosh, well, there's many. The first one that jumps to my mind thinking about, medicine in contact with some of these questions of representation and bias. There's a great book called Invisible Women, that looks at specifically kind of gender representation in a number of areas, but including clinical trials. And I think there's a lot of really interesting history there, which is not machine learning specific per se, but it touches on that same family of issues.
Yeah, interesting. No, and that's a very relevant thing at the moment, is about, diversity within clinical trials, and, whether the drugs that we're producing are, fit for purpose for everyone that they go to after they've gone through the clinical study. So that's an interesting recommendation. So Brian, thank you so much for tuning in, and can you give us a hint of what's next? What are you working on next?
Yeah, in a few months, there's a project that I've been working on kind of in parallel with this, with my longtime collaborator, Tom Griffiths. So it will be kind of a sequel of a kind to Algorithms to Live By, but looking at group decision making. So
Interesting.
our previous book together, Algorithms to Live By, really looks at uh, you, the individual decision maker, are confronting some problem in your life, in the environment, and how does that, you know how do we derive insights from kind of classical computer science of a single machine that's just grinding away on a problem until it solves it. um, but increasingly, computer science is moving towards distributed systems where you have a bunch of different computers kind of sharing resources and working together. And of course, that is the environment in which most human decisions get made, whether it's
Mm-hmm.
your family or your team at work or your, society, whatever scale. Um, so that was an opportunity for us to kind of widen that lens and look at these questions of how to work together, how to coordinate. So that'll be a few months down the line, but I'm excited for that.
I bet that's a very pertinent question, especially in our space, right, where you got this idea of multidisciplinarity, interdisciplinarity, imagination, creativity,
Mm-hmm.
a bunch of other things in the mix. So excited to see it.
Yeah, and maybe we can have a future conversation about that as well.
I hope so.
Yeah,
Brian, thank you so much for coming on Idea Collider.
it's my pleasure. Thank you.
Thank you.